right? Primarily spread by respiratory droplets from cough. Okay, now listen, this is very important, okay? A respiratory droplet usually only travels 2 to 3 feet. That's why, by the way, the World Health Organization said all the social distancing you need is about a meter. That's why the American Academy of Pediatrics said in schools, if you get the kids a meter apart from each other, it's more than enough, right? So the 6 foot distance thing is like, extra or whatever like that, but probably not necessary. Also, when they talk about droplets, we're talking about large, wet, heavy things, right? Those are the ones that carry most of the virus. Those are the ones that drop to the ground quickly, right? Which is why it's not true that it's going to be something that exists in the air forever. When they say that, they're talking about aerosols. Okay, so look. Aerosol. There are different sizes, right? So we talked about the droplet, right? That's the large one, greater than 100 microns, right? Thoracic, smaller, and the respiratory, those are the really small ones, the one they call aerosols. They also call them droplet nuclei. You may hear these terms, right? And an aerosol, yes, it can last in a room. We see that in medical procedures, right? Where you have these ongoing pieces of equipment generating aerosols. But in general, this is not going to be an issue. Yes, it's true. There was a story, research about Skagit Choir. Okay, so it's up to the state of Washington. You had all these people in a small room standing shoulder to shoulder, singing their lungs out. Okay, right? If you're going to give me that scenario, then yes, aerosolization with small little respiratory droplets happens, right? But the only scenario that you can give me that's going to be something that's a problem is when you go to a very small room, lots of people, closed ventilation, right? And there's even criteria for how you notice ventilation room, right? Less than 3 liters per second, right? It is a worrisome thing. Ideal is 8 to 10 liters per second, right? There's ways of doing this, right? There was aerosolization in some tall buildings in China, right? And in those tall buildings happen to be that the way they do their flushing systems and their valves and their toilets and stuff led to all this trouble, right? So is it possible that some little fine mist somewhere could cause trouble? Look, anything is possible. Let's talk about medical reality. The reality is these goes by large droplets. It's much more rare to be in those small aerosols. It's much more rare, right? You're just not going to get enough of it, right? Let me give you an example. Look at this. Aerosol for measles. Aerosol for measles has an attack rate of 85-90%. Anybody ever hear when they used to do chickenpox parties or measles parties, right? What was that? That was where it does travel by aerosol. That's where you don't really see much, don't really see maybe a little bit of cough stuff, but that's where it's going to happen. Corona in healthcare workers. People are exposed in the hospital. Maybe you get aerosolization 10%, maybe, right? And in the households, you maybe get a 10. If you want to be generous, okay, I'll give it to you 40% of the time in one study, right? But that's extremely rare. And you got to think about this. These are people living next to each other, right? That are having this situation. So it's extremely rare to be anything like that. It's the respiratory droplets, and that's the big thing. Okay, next. Very important epidemiology. Look at this. There is no transmission if the infected person was sick for at least 6 days, maximum 10 days, and it's rare if it's severe 14 days, okay? So remember these numbers, right? When they start talking about who we're exposed to, when we're exposed, if you're looking at a claim, if you're trying to figure out, oh, I just got a call from my kid's school, or, oh, my wife just said this or something, you look at those numbers, keep those numbers in mind, right? Because if somebody gets sick, right, yes, they'll be transmitting virus initially, but it drops off very quickly. Okay, and that's something I want you to keep in mind, right? Let's take a look at how some of this looks, right? So here we talked about those droplets, right? So look here, right? When you have the large droplets, the ones that carry most of the virus, right? Those large droplets, they fall to the floor in 3 to 5 seconds. That's it, right? So it's gone. It's down on the floor in 3 to 5 seconds, right? That's the ones that carries most of the virus because those are the large, wet droplets, right? Those are the ones that are going to carry the virus, right? About 90% of the virus is gone at 6 minutes in sun exposure, right? Which is why I tell all my patients, get outside. I can't begin to tell you what will light me up when we start talking about these people that closed beaches and closed parks, it is the dumbest thing I've ever seen in medicine, right? It's the opposite. You want people outside. You want them outside for multiple reasons. One, because they're going to be more likely to exercise. Two, they're going to see sunlight and have better circadian rhythm. Three, they're going to be with the sun exposure and they're going to kill off the virus anyways. Four, they're not going to get depressed from being locked inside all the time, right? It is nonsense. And this stuff about, oh, everybody, no matter where you go, walking outside, you have to wear a mask. It's just not true, right? It's just not true, because look at the data, look at the science, and you'll see why this stuff is not true, right? So yes, can there be anything else? Anything is possible, right? But there's no study that's ever been able to culture these live viruses from the magical, mystical air, right? And that's always been shown. By the way, there's ways to study this. Look at this. Look at this. This is the original Gesundheit chamber, okay? This is from a study in 1966 in Fort Detrick. They're looking at how people cough and sneeze and how things travel, right? Here's another one. The short-range droplets imaging from a 1942 Genesis experiment, right? Where they show what these distances are, right? And then there's this one that ended up in the newspaper, right? This long-range video saying, okay, look at this cloud. This cloud went up to 7 to 8 meters, right? Okay, look, if you want to give me, you know, we're in the Super Bowl time. You want to give me one of the Super Bowl players that's the size of a house and he leans back and coughs and sneezes, you know, and can project, okay, anything's possible, okay? But let's just talk about reality, okay? Look at these droplets, the ones that have most of the virus. See, they're dropping off right here? They're dropping off, right? You can get these little mists, but these things are not going to cause trouble unless you say to me, Mark, I'm going to a room with 100 people and it's 10 by 10 and there's no windows. Okay, then anything's possible, right? But if you want to talk about reality, this is not going to happen, right? Right, next. Incubation period. Look at these numbers. Please keep these numbers in mind, right? How long does it take after exposed for the virus to incubate? About 4 to 6 days. Rarely can it get up to 10 to 14 days, right? Now look at this next number. Please, please, please look. Not over 97% of patients are nasopharyngeal positive by 9 days, which means if you're exposed to somebody and you want to know, well, did I get it or not, right? If you wait until about 8 days or 9 days and go get your nasal smear and it's negative, you're essentially done, right? And so that's why you can look at those numbers and kind of think about, okay, well, why are they saying, you know, isolation periods and quarantine periods and all that kind of stuff? Part of that comes from that, but part of it is just margins of safety, right? Okay, next, viral shedding. Viral shedding occurs 24 hours before symptoms. By the way, folks, this is very important. I want you to keep this in mind, right? Everybody said, people always come in and say, oh, you know, Mark, I'm sick and I'm worried about my kids. One, don't worry about your kids. Your kids are almost certainly the source of your sickness. Two, when you get a virus, right, you are usually most infectious before you have symptoms. That's just the way viruses work. They're not dumb. They figure, okay, tell you what, we're starting to replicate here. Let's get out of here before the guy figures out he's sick and doesn't let us, go on to infect somebody else, right? So you're most infectious 24 to 48 hours before symptom onset. And in mild cases, you could probably shed virus for 7 to 12 days. In severe cases, you may be able to shed virus for 20 days. But, this is the but. Please keep this in mind. You can have virus coming out of you, but after about 6 days, you're not going to infect anybody. You're going, well, how's that possible? I'll tell you how that's possible. Because as you get better, the amount of virus coming out of you gets less and less. As you get better, the viral particles that are coming out are not all healthy viral particles. As you get better, you're not sneezing and coughing as much, right? And so that's why you don't have to worry. That's why, for example, that's why I have this here. You can shed virus for weeks, right? I've had patients and people say to me, oh, well, I got this guy. Oh, hold on, where we go here. I got this guy that went and got tested, right? This person went and got tested 2 weeks later and they still had the virus. I don't care. So what? It doesn't matter, right? You can have virus for weeks and weeks and weeks after you're better, right? They're not going to cause infection. They're not going to transmit. There's not enough of them. You're not emitting them enough, right? The majority of people, by the way, will have no or mild symptoms. Look at this number. About 70, 80% of people will have no or mild symptoms. right? I'm not saying it's not a big deal. I'm not saying it doesn't hurt people. I'm not saying it doesn't make you sick. I'm not saying that people haven't died. What I'm saying is that's the data. The vast majority of people. So when people say, that's it, my life is over, I can't go out. Do you know how many patients I've had to put on SSRIs this year because they're sitting at home, isolated, miserable, because they were convinced that if they get one sniffle, the life is over, right? It's not even close to reality, okay? I want to give you another thing. Look about this virus shedding and stuff. There's something that's very important, so stay with me. You've heard about viral testing, right? So the virus can shed but not be infectious, right? So sometimes people get reports say, oh, my PCR was positive, right? Let me tell you something about PCRs, right? PCR depends very much on what's called the threshold cycle count, okay? Which means that there's a way that the test is run, that depending on how that test is run, it may be read as positive, but it's not an infectious positive, right? Nobody ever tells you that, right? But you need to know that. That's why I have patients that said, well, I went and got routinely tested because I want to check. It came back positive, right? Well, of course it's going to come back positive, right? It's going to come back positive because you just had a chance of some random false positive, or you're going to have a chance of maybe showing something that's not there, right? There is no difference in the level of virus between those who are asymptomatic and those who are severe, right? Everybody says, oh, that person was really sick, so their viral level is much higher. You know, it turns out it's not true. It turns out you could have somebody who has no symptoms and they could transmit the virus. You have other people very severe and they're not more likely to do that, right? And by the way, one of the reasons we got this data is from the NBA. Remember last year they had the NBA in the bubble thing with all that stuff? Okay, so we could do studies on the NBA, and it turns out that after about 3 days, they started having proliferation, right? So if you test everybody every day, you can start seeing it. Remember I told you the incubation period, about 4 to 6 days, right? So by about 3 days, they started to see a little bit of virus coming out, right? And then 6 to 10 days was the clearance phase. So on these people, they cleared that infection, right? So that's why it's very important and very important that you keep that in mind, right? I'm not saying, you have to understand this very carefully. I'm not saying it's not a real disease. I'm not saying people have died. I'm not saying that it's not a problem. What I'm saying is that the vast majority of infections are mild. The vast majority of people do well. The vast majority have an ability to clear this infection, right? The data are overwhelming that. And so that's why I want you to keep that in mind, okay? Next, look at this. Here's another way to represent this, okay? You have the latency period and the incubation period, right? So this is where you get exposed, and then you start having the virus replicating, it's incubating, and now you start being able to transmit the virus. Look. See how you have people giving infection and transmitting before they have symptoms, right? So that's a kind of way to look at that in a graphical way to understand that, right? Okay, next on epidemiology, surfaces, right? Okay, first of all, you need to know the following things. When they say, okay, I see that they have this stuff and it can exist on these surfaces, I'm going to wash my groceries, I'm going to wash the boxes and stuff like that. Okay, first of all the studies are done. When they did these in labs, they put viral loads on these lab particles that have never been replicated in the real world. What I mean by that is they took all these types of surfaces and they took huge viral loads, put them directly on the surface and said, how long do they last? Okay. But in the real world, in those large droplets, you're not going to get that kind of viral load, right? And one study on the half-life of a virus had 1.5 to 2.5 days with the virus at certain degrees and temperatures. But when you don't have light exposure, right, it makes a big difference. So a lot of packages are delivered. A lot of things are going in and out of a car, right? When you have light exposure, it also kills off viruses, okay? Next, you need to know when you hear these studies about, oh, there's a virus on here or something like that, what they're talking about are viral particles. It's not necessarily the whole virus. It's not necessarily ones that could cause infection. So here's another way to look at it. Look. Now, stay with me on this. Okay, this is SARS-CoV-1, SARS-CoV-2, right? The two SARS infections. And these are the different surfaces: copper, cardboard, steel, plastic, right? And you can see how quickly they drop off. By the way, notice that copper, right? Notice how that's going to drop off very quickly, right? That comes up a lot of times in certain surfaces and things we talk about. But look at how quickly they drop off from those surfaces. There is no data whatsoever of any fomite transition. None. Zero, right? So all the boxes is okay. Now if you say, well, but you know, what if, okay, I guess anything is possible. If somebody has a box and they cough and sneeze all over the box in huge heavy droplets, and within 2 minutes they're at your doorstep, and then you go and pick it up with your bare hands and say, oh, I wonder what this is, and I'm going to wipe it over my face. Okay, I guess anything's possible, right? But short of that, let's talk about medical reality. In reality, there is no fomite transmission. And by the way, that's all through. The CDC has it, everybody thing. And so that's why it's important to keep that in mind, okay? When they talk about contagiousness, right? Contagiousness. This is called the R naught, right? Which is the reproductive rate, right? And in general, this is 2.5, which means for every person infected, they'll give it to 2 to 3 people. By comparison, influenza, it's 1.3. So please keep that. They're very, very important, right? There's a difference between virulence and transmission and illness, right? So what does that mean? So that means that if something's more virulent, if something's more easily transmitted, the R naught is higher, right? Whereas if something doesn't jump as easily from person to person, then the R naught is lower. So when you have mitigation efforts, that R naught can get less than 1. And that's when the spread will end, right? And there's even something you may have heard about herd immunity. There's a formula for that, right? And what's the true herd immunity? It depends on the studies. It depends on the illness. It could be anywhere from 15% up to 70%, right? And we're going to see exactly, and then we can use them as a measure of how we're trying to think through this and make sure that you understand what's going on with that epidemiology, okay? Now, next. You have heard about predictions where they said how many people are going to die, how many are going to see. Okay, look, there's multiple issues there. First of all, a lot of this stuff came from the Ferguson's work at Imperial College. They were wrong before, they're wrong again on this one, right? They were predicting millions, and the reason it didn't get to that number is because their models did not take into account personal factors, mitigation factors. Do you remember, anybody remember mad cow disease? These are the same people who told us that we were going to be slaughtering the entire herds of the United States, right? Never happened, right? If you're looking for some kind of reasonable kind of predictions for this forecast of the future, maybe the Reich Lab can help you with that to get an idea of what's reasonable and a thought through process of how to predict these things. Let me just show the one to you. Just one, just an example, right? Look at this graph, okay? I know it's busy. I just want to highlight to you how important it is to be always careful about looking at the literature, looking at the science, looking at the reports to understand things, right? Here's a graph, right? Then this has been replicated many times since then, okay? And so here is a graph, right? So look here, look. Do you see these are the infections over time, okay? And so what this study says, okay, look, you get to a place where you have 1 million deaths per million at 21 days versus shutdown, right? And so what should happen is those people that shut down quickly, according to what Ferguson and Imperial College said, should have less infections, and those that shut down much later should have more infections, right? But it's not true. All these entities, all these countries, all these states, all had large infections on a per capita basis, but they shut down quickly. All these people over here shut down late, but they didn't have huge amounts of infection over here. That's because the full economic shutdowns don't work. They have not worked. They will not work. What does work? Social distancing helps. Does masking help? We'll talk about a little bit. It helps a little bit, right? But again, not full economic shutdown. You say, well, why is that? Why is it not helping, right? We've been shut down and the cases are going up, right? So if the cases are going up and you shut down, it should tell you it's not working. The second issue is, why does it not work? I'll tell you why. Because what happens is when you tell people, that's it, go home, don't go to work, you're sending people into their living environments, right? Where there's actually no protection being practiced. And 2, most of the people that are the workers that got shut down out of their jobs, not the white collar people, not like you and me can work remotely. These are people that are laborers. These are people working in the restaurants. They go home. They go home to high density living. They go home to crowded apartments, right? And so what happens is you're setting it up the opposite. You're setting it up, and that is the important thing about what you need to know about. Okay. All right. Next.